Hello and welcome back. Today we're going to talk about Chapter 16, Reducing Your Risk of Cardiovascular Disease. In this lecture we're going to discuss the social, physical and economic burden of cardiovascular disease in the United States. We're going to talk about the anatomy and physiology of the heart and the circulatory system and the importance of healthy heart function. We're going to review a variety of different types of cardiovascular disease and their prevalence. We're going to talk about some risk factors for cardiovascular disease and how you might prevent cardiovascular disease. And we're going to examine strategies for diagnosis and treatment of cardiovascular disease. So let's take a look, an overview at the epidemiology of cardiovascular disease. Cardiovascular disease claims more lives than cancer every year. It is the most common cause of death for Americans. More than 1 in every 3 adults will suffer from a type of cardiovascular disease during their life. Men suffer more from cardiovascular disease at every age. Nevertheless, it is a significant disease in women as well. And heart disease is a leading killer of African American and white women in the United States. So let's take a look at the prevalence or death rates for cardiovascular disease across the United States. What I hope you can see is in red here in the southeast of the United States. Cardiovascular disease is unfortunately very common, with death rates approaching 300 per 100,000 of the population every year. That's a very, very high death rate. You can see that California is in the middle here with around 200 deaths per 100,000 of the population. If we look side by side on the left here at smoking, on the left we look at cardiovascular deaths, and on the right we look at smoking incidents. You can see there's broadly speaking a parallel in the increase in smoking and the increase in cardiovascular deaths. Not a lot of people realize this, but smoking is the major risk factor for cardiovascular deaths. And that smoking will also include vaping. So be cautious with any kind of smoking. The damage it does to your cardiovascular system, to your heart and lungs, can be permanent and can result in cardiovascular death later in life. If we look at the prevalence of cardiovascular disease by age, you can see that it dramatically increases from 20 to 39 to from 40 years and older. The dramatic increase in the risk of cardiovascular death in both men and women. Nevertheless, even for 20 to 39-year-olds, college student-aged people, there is a risk of cardiovascular death around about 10% of the population. Let's go through some cardiovascular terminology. Things you'll hear are words like atherosclerosis or arteriosclerosis. This is the accumulation of lipids or fats inside, that's in the intima, of arteries throughout your body. Those are veins and arteries that are carrying blood around your body. An aneurysm is the dilation or ballooning of an artery. Oftentimes this is associated with high blood pressure. But aneurysms can burst and can result in significant morbidity and mortality. Ischemia, that is insufficient blood supply, particularly to the heart. An infarct is an area of death or necrosis that occurs due to insufficient blood supply. If that infarct occurs in the heart, that's called a myocardial infarct. That's commonly known as a heart attack. That is because there has been insufficient blood supply to a part of the heart, and that part of the heart has died due to lack of oxygen. A cerebral infarct is commonly called a stroke. That is where the blockage occurs in a vein or a artery leading to the brain, And when that is blocked, there's no longer oxygen delivery to that part of the brain, and that part of the brain will die, causing a stroke. If an infarct occurs in the extremities, it can cause gangrene. And stenosis is when blood vessels start to narrow. When blood vessels start to narrow, it's a little bit like putting your finger over the end of a hose. The pressure increases, the blood pressure increases. Embolus is a plug or a clot. Sometimes that's due to an infection, a clot of bacteria. Sometimes that's a blood clot occurring because your heart is crushing red blood cells. The valves are crushing red blood cells. That would happen with a condition like atrial fibrillation. And that's why people who have atrial fibrillation need to go on blood thinners to prevent damage to blood clots, creating blood clots. A thrombus is a blood clot that will occlude an artery, and that can cause a stroke. And hypertension is high blood pressure. When we look at coronary cardiovascular diseases, you can see that coronary heart disease is the most common, followed by stroke, and then there's high blood pressure and heart failure occur next most common. Here's a picture of the heart. You can see that the heart has a variety of different chambers. It has a left side and a right side, and the heart has two functions. One is to pump blood over to the lungs where the blood picks up oxygen, and the other part of the heart's function is to take that oxygenated blood and pump it around the body. It's an incredible machine with these four chambers. It contracts about 100,000 times every day and pumps 2,000 gallons of blood throughout the body. In a lifetime, your heart will beat about 2.5 billion times. And contrary to my father's thinking, you do not have a limited number of heartbeats in your lifetime. Your heart is a muscle like any other muscle in your body, and you can build it up to be stronger by working out, and that means by training it by doing some kind of aerobic exercise. Generally, that exercise doesn't have to be very intense. It can be quite moderate. Moderate exercise is perfectly good for building up strength in the heart muscle. Let's talk about atherosclerosis or coronary artery disease. It's characterized by these fatty deposits, often containing cholesterol and sometimes calcium and fibrous substances that stick on the inside of the walls of your arteries. Plaques can be either hard or soft, so the composition of the plaques makes a big difference. If they're soft, they're pliable, and they don't tend to tear, rip off, and cause blockages as frequently. So hard plaques are the ones we want to be most concerned about. The composition of those plaques is affected by the composition of the fats that we eat. If we eat hard fats that are hard at room temperature, things like butter and lard and fats found in meat products like beef and pork, you can see that they're very hard at room temperature. They will also form hard plaques inside of your body, whereas polyunsaturated fats, things found in oils like olive oil, that's a monounsaturated fat, or canola oil full of polyunsaturated fats, those kinds of oils tend to be cardioprotective, and that's because if they do form plaques, they tend to form these soft, pliable plaques, which are much less dangerous in terms of cardiovascular risk. Hyperlipidemia is a condition in which a person has abnormally high levels of fats. That creates the formation of more plaques, either hard or soft plaques in the body, but the creation of more plaques places you at higher risk of atherosclerosis and coronary artery disease, leading to heart attacks. Hypertension is related to the buildup of these plaques. You can see on this slide, particularly there at the bottom, how a plaque might form narrowing an artery. And when the artery narrows, the smaller diameter that the blood is forced to go through increases the pressure. That'll increase your blood pressure throughout your body, and increased blood pressure is a risk factor for aneurysm and stroke. That is measured using a cuff, typically using a cuff around the upper arm. You should get your blood pressure measured fairly regularly to make sure that you do not have high blood pressure. If your blood pressure exceeds 140 over 90, that's systolic to diastolic blood pressure. That's when your heart is pumping and then relaxing. Those are the two pressures. It's pumping, that's the systolic blood pressure, and when it's relaxed, there's a diastolic blood pressure. Those are the two numbers that you're getting. If those numbers exceed 140 over 90, you have hypertension, high blood pressure, and you need to talk to your doctor about getting treatment for that. Exactly. Here we go. Table 16.1. You can see that normal blood pressure less than 120. Elevated is that 120 to 129. High blood pressure stage 1, 130 to 139. Higher than 140 is hypertension stage 2. Higher than 180 is a crisis that needs immediate attention. You should definitely talk to your doctor as soon as your blood pressure exceeds 130, and definitely get treated if it's over 140 regularly. Here we're looking at atherosclerosis, where that on the right, the bottom right, you can see the restricted blood flow and that atherosclerotic plaque. If that plaque peels off, it can fully occlude that blood vessel, and if that blood vessel is fully occluded, that cardiac vein can no longer deliver oxygen to the heart muscle. The heart muscle will become damaged and may die. If there is significant damage to the heart and it can no longer function correctly, that's going to cause a heart attack. Myocardial infarct is part of the coronary heart disease spectrum. It's caused by these by those disruption of blood flow. You can sometimes see blood clots that will cause heart attacks as well. When an embolus occurs and is lodged in that circulatory system, that will also cause a heart attack. But more common is one of these lipid plaques blocking an artery. Some signs or symptoms of a heart attack: crushing or squeezing chest pain, radiating pain, particularly down the arm, pain in the neck or the jaw, shortness of breath, weakness, fatigue that is unusual, sometimes sleep disturbances, and sometimes indigestion-like feelings. All of these are signs that you should get your heart checked out. A stroke occurs when blood supply is interrupted to part of the brain, and that can be either caused by a blood clot or an embolus. Sometimes an aneurysm will cause a stroke, and sometimes a stroke can be caused by a fatty plaque that is peeled off and lodged in a blood vessel to the brain. A transient ischemic attack is a brief interruption of blood flow which returns to normal. Sometimes you can see loss of functions like loss of vision, but then that will, if it's treated rapidly with clot-busting drugs, that can reverse and a person can completely recover. Stroke treatment is very time dependent. So if you see a person that is suffering from a stroke, get them treated immediately. Take them to hospital immediately, because the quicker you get them treated, the faster they can recover and retain function. Some symptoms of stroke that you might see will be things like facial droop, numbness, loss of vision, difficulty with speech, loss of capacity to move one half of the body, either the left or the right hand side. All of these are signs that you should act fast. Get them to hospital quickly. The quicker you do so, the more function that person can retain. There are very effective treatments, but those treatments need to be given in a hospital setting.